All right, good afternoon, everybody. Here at a slightly different time. It's very busy down in Washington, D.C. The president just signed his executive orders regarding COVID protocols. And at 4 o'clock this afternoon, his top spokesperson, Jen Psaki, will take over with Dr. Fauci to answer some questions. So I wanted to get in the break while we could. Little pushy of Jen Psaki, I thought. She is a Connecticut woman. She graduate of Greenwich High School, but I think what she has to say is pretty important, so I'll just pre-roll that. And it's sort of ironic. She was Greenwich High School, and so is Hope Hicks, so there's something in the water down there. Let me just give you a brief update on where we are on COVID. I think what's interesting here in these numbers, again, a lot of tests. The positivity rate, 4.3%, trending down a little bit, as you can see, over the last few weeks. I think we're now at about 5.2% is the 7-day average. Sort of along the lines of Rhode Island and Massachusetts, a little less than New York. But I think you should know something. I mean, our rates in this region are going down a bit, and the rates across the country are going down a little bit. Hospitalizations down 55. Of course, that's a key metric and extraordinary good news. Fatalities plus 48. No good news there at all. But because of declining positivity and because we've had a pretty stable COVID front, really now going on for a couple of months. This is an appropriate time, I thought. Our schools are getting back open again. About half our kids have the option for in-person education, which is, again, I think very important for a lot of families, a lot of kids, a lot of teachers, and really some of the best in the region, which I'm very appreciative of. Really happy to say that at Danbury and New Haven, those kids have been out of school for, quite some time. At least for the elementary kids, they have an in-person option now, so that's good progress. And as of a couple days ago, we started practice for our winter sports, and those games start, I guess, on February 1st. So we're watching the metrics carefully, but we are continuing to make progress, I think, every day. Some of that, I think, is thanks to the vaccination program rolling out. We've done pretty well here in the state of Connecticut in terms of getting off a higher percentage of our people vaccinated. 47,000 people over the age of 75 vaccinated. About close to 260,000 vaccines overall distributed so far. There's one choke point. We need more vaccines, and I've got the opportunity to now explain to the White House and others what this means and how we got to do everything we can to accelerate the production of vaccines. We've, in Connecticut, and I think increasingly states across the country, have the capacity to vaccinate a lot more people if we had it. Josh and I just got off the phone with some of the leaders from Pfizer. Obviously have a strong Connecticut presence, probably the lead vaccine in the country. A majority of ours comes from Pfizer. And they said, look, right now there's a real chance that by the end of February we'll have doubled the production of vaccines. And by the end of March we could do that again. And we just said, look, it's really helpful to give us some planning so we can make sure we have the capacity out there. But we do right now have the capacity to use those vaccines. Seeing is believing. We get 1 week allocations from the feds. So those are the dates we still have in our projections. But there may be some good news coming forward there. What else do we have? Who's been vaccinated so far? You can see that, start from the bottom up, for those who are older, 85 and over, 21% have received their first dose, 75 to 84, 15% have received their first dose. So enough to make a real difference. I think you can see the numbers go down a little bit as you get, much younger. You may say, well, how come 65 to 74 is a little less likely to have been vaccinated than 10 years their junior? I think because 10 years their junior, they're still working in healthcare. So they were there as part of those public health essential workers, while 65 to 74 were a little more likely to be retired. It's worth noting when it comes to vaccines, when it comes to the protocols, when it comes to what we can learn and how we can do better. Very pleased that the National Governors Association, led by Andrew Cuomo, has recognized the good work that Connecticut has done and recognized the good work that Tennessee has done. So they made Governor Bill Lee of Tennessee and myself, chairman of the COVID, governors group. We are going to act as the interface with the federal government, distilling best practices from all of our fellow governors, and being able to take our message to the federal government, how important it is to use the Defense Production Act, jumpstart production of the vaccines, give us a couple weeks' notice so we can count on that production going forward. I will say it's also as regards, it's COVID and public health and public safety. And we'll be taking the lead there as well, putting together the rest of our governors on that front. Public safety involves cybersecurity, where, again, which knows no state borders. Very important that we do this on a regional basis. I've been on that public cybersecurity task force for the governors for the last couple of years. I come out of that world, so just other reasons that will be represented there. And finally, we'll also be in charge of the Guard, the Connecticut Guard, the National Guard, and making recommendations. So happy that President Biden is giving us 100% reimbursement for our Guards. You know how incredibly important their work has been to date. This is just an example of some, we know about of our 5,000 guardsmen, most of them are posted overseas at great harm, leaving family and loved ones behind. But in addition, there have been about 1,500 every day, those guards, especially over the last year. The Connecticut Guard taking the lead in terms of COVID when it comes to our setting up our mobile field hospitals, when it comes to the warehouse and PPE distribution, helping out with food distribution. The Guard has been going to the nursing homes, making sure that the testing and infection protocols are being strictly enforced. A big shout out to our Guard. I'm here with General Yvonne, and he and I have been talking about some way that I can thank those guardsmen who have been on the front line here in Connecticut every day. Here in Connecticut, protecting our state capitol, which thank God nothing untoward happened over the last 5 days. And we did send a few hundred guardsmen down to Washington, D.C. as well. Look, prevention, nothing wrong with prevention. It made an enormous difference in terms of keeping a very successful inauguration safe. With that, we've got General Yvonne here for questions, as well as Paul and Josh. In the interest of time, why don't we just jump to questions?
News 8.
So, Governor, I know it's only day one, and the Biden administration just signing the executive orders now. What do you see as they're kind of starting from scratch to revamp? We don't have enough vaccine now, you're saying. Is it going to go down before it goes up? And I hear we're getting about 50,000 doses a week. Is that still what's happening, the case?
Yeah, we're getting, almost 50,000 doses a week. That is not going to go down. What we were working on with Pfizer, and I was talking to my friends in the COVID team down in Washington, what we can expect in terms of a ramp up. What are the bottlenecks in the supply chain? What can the feds do with their Defense Procurement Act to speed things up? Right now, I'd say the number one bottleneck is probably the incredibly customized, specialized equipment you need to mix the vaccines, and it's not something you mass produce. Okay, we knew that, but we also knew that 3 months ago. Where are we in that process? That's what we're going to be asking.
Okay, and then looking forward, New York across the border is now saying just because you have a reservation, you might not get it. Is Connecticut in that situation?
No. Right now, you get a reservation, you're going to get your vaccine delivered on schedule.
And a final question. Massachusetts just opened up across the borders restaurants, got rid of the curfew on Monday. Will you do the same, or are you considering that?
Not yet. I'll tell you why. As I mentioned, our schools are just reopening right now. Our high school sports are just coming back. Colleges are just coming back. We've had another couple of the extremely infectious strain of virus. So I think it's really prudent to let's take a look in a couple of weeks. But I appreciate the trend.
Thank you, Governor.
Channel 3 Eyewitness News.
Yes, Governor, a quick question about the vaccine timetable. Is it dependent on other companies, say Johnson & Johnson or AstraZeneca, to offer their versions of the vaccine? Or is the current timetable that we have based on the two companies that we have right now, the Moderna and the Pfizer vaccines?
It's based on Moderna, based on Pfizer, what we've got right now, and what the allocation has been over the last few weeks continuing forward. If Johnson & Johnson comes forward, we get something, say, a green light by the middle of February, that will be incremental to everything we've projected, and we'll be able to vaccinate those vulnerable populations even faster.
You could see an acceleration then to this timetable.
I'd like to see that.
NBC Connecticut.
Good afternoon. Piggybacking on the question you were asked regarding New York, wondering, Yale New Haven Hospital says they need more vaccines. So is Connecticut even at risk at running out like New York?
No. The 46,900 we've gotten them consistently. We've got them allocated. Could I use 5 times that amount? Absolutely. Do I hear from hospitals every day, give me more? Absolutely. But that's why we're doing this by appointment. We got this on a schedule. We've narrowed the cohort of people who can get it. And if they give us more vaccines, we can speed it up.
These vaccination clinics like the one at Dunkin' Donuts Park are going up very quickly. How are you getting the word out to people to let them know these sites are available?
Josh or General Yvonne, do you want to talk about how we're getting the word out?
Absolutely. So again, as always, the best place to go for information is ct.gov/COVID vaccine. We maintain up-to-date lists. We're getting ready to actually post an interactive map as well, similar to what we did for testing sites, as we see a continued proliferation of more of these sites around the state. But as the governor said right now, we are already at a point where there is far more capacity built today to administer doses than we have supply coming in from the federal government by a significant order of magnitude. And we have multiple sites around the state who can do more than they're doing right now, but we just don't have the supply to give them. So as the governor said, the patience is required simply because we don't have enough coming into the state, not because we lack sites or people to administer the doses. It's just we need more vaccine.
So how quickly are these clinics filling up? I imagine if someone has an appointment in a month from now, they should try to get in sooner as more of these clinics do open?
Yeah, we're constantly, and I know all providers are constantly looking at opportunities to move people forward as quickly as possible if more doses come available. But, for now, we're gated by the amount of vaccine we get into the state.
Okay. And lastly, the governor, you touched on your appointment to the Pandemic and Disaster Response Task Force. How do you see that benefiting our state?
I think it's a good recognition of the good work that our state has done. I think having a direct access into the federal COVID task force is a big plus for us. I'd like to see a little more direction coming from the federal government, a little more lead time in terms of what we can expect in terms of vaccinations to make sure we're there. I think it's good recognition. And on the disaster front, look, we've had ICEA, we've had a number of hits ourselves, so I think it's very productive for us to coordinate FEMA, cybersecurity, and the Guard along with our fellow governors. It's a plus.
Thank you.
Fox 61.
Hi, Governor. What are you asking from the new Biden administration for right now and in the coming months? Requests on Connecticut's behalf, in addition to the increased supply of the vaccine that you already mentioned?
The best thing we can ask for when it comes to COVID is certainty, give us some lead time going out in time, And let's speak with one voice. That didn't always happen over the last year, to give people clear guidance, what they should be doing every step of the way. On the budget front, as you know, it would be very helpful if they gave us some clarity going out, not just 6 months, but maybe 2 years, as we deal with our fluctuating revenues that have been impacted by COVID. That allows us, that allows small business, that allows the superintendents of schools all to plan accordingly.
And then, do you have a time frame for when you plan on receiving the COVID vaccine?
I think my age group maybe comes up in the next few weeks, and I probably would take advantage then.
News 12 Connecticut.
Hi, Governor. February 9th is coming up pretty quickly here. Are you planning anytime soon to seek an extension of the emergency powers?
Hey, Paul, you were talking to the leaders about that. You want to take that?
Yeah, we've been having informal conversations with members of the legislature as we gear up for an official request to the Gang of 10 as it deals with the emergency powers. Obviously, you can see as the governor is talking about vaccines, talking about the importance of our National Guard, importance of our overall response. It's going to most likely be beneficial for us to make an official ask as it deals with our emergency powers. But we haven't had any official conversations with the legislature on that end, and we look forward to doing that very soon.
Would that be another 6 months? It sounds like they're looking for something shorter.
Well, right now, as I said, we haven't had any official conversations with the legislature. We obviously understand, just looking at our 1B vaccine schedule, while leniency will probably be beneficial, but there's still more work that we're doing here in our office internally and before we get final sign off by the governor. But we do look forward to having official conversations with the legislature in the coming week.
And just one final question. Following the riot at the Capitol, the Public Safety Committee today moved forward on perhaps creating a new division of the state police just to look at extremist groups and hate crimes. Is that something that you all would support?
Let me take a look at that. That's the first I've heard about it, or maybe we broaden the scope of what, for example, our state police do. And believe me, they pay special attention to those extremist groups, in particular tracking on social media. What you don't want to have happen, to your previous question, is have all the executive orders just stop on February 9th. So that's not very good. Whether we extend the orders for 2 months or 4 months, Paul and the leadership can figure that out. And in the meantime, legislatures, back in session. If there are any particular orders that they really don't like, tell me, or even if you want, just, cast a vote in the legislature to, open the bars or whatever your priority might be, because you have a chance to exercise that privilege if you want to.
WTIC 1080 News.
Governor, you're very busy with all this COVID stuff. The National Governors Association appointments, how does that affect your time clock, I guess, your work schedule?
Hey, look, this is what I'm doing about 18 hours a day, which is COVID with some disasters thrown in other disasters thrown in along the way. So the chance that I am in a better position to learn from my fellow governors and to share information with the White House, I think is going to make my life and Connecticut's life easier and better.
The standard line on talk radio about your emergency powers is that you're interested in a power grab, interested in running people's lives. These are just things that I hear people say. What's your response to those folks?
Look, as I said before, this is the legislature granted me this authority because of the nature of the real-time decision-making we've got to make. We had to set up Rentschler Field. That required, making some changes on short order. And again, if there's any extension, it's only with the permission of the legislature. And if there are any executive orders the legislature don't like, cast a vote on it.
If you don't get that extension, how would that affect the work that needs to be done?
I don't think that would be very good. Either they can vote on each and every one of the 80 executive orders, or they all end on February 9th. We're going to work this out. We've got good leadership on both sides of the aisle. We're going to find a good compromise going forward.
Connecticut Public Media.
Good afternoon. Is Connecticut tracking vaccine waste, like doses that have been discarded because of improper storage or handling issues, or weren't thawed properly? And if so, how many doses have gone to waste so far?
Josh?
We do ask providers to let us know if there are wastage issues. Actually talking about this earlier today. The only thing that's been reported back to us at this point is one vaccine administrator accidentally dropped one vial at a vaccination site, which broke and was obviously wasted as 5 doses. That's the only event that's been reported back so far. So, look, our provider community has been doing an absolutely amazing job rallying the troops on short notice. And based on the guidance from the Department of Public Health, which gives prescriptive guidance on what the prioritization should be, but also puts a lot of trust in our healthcare providers to balance that daily schedule. I think the results are speaking for themselves in terms of how efficiently we're getting use of all of those doses that are going out.
And last question, some health districts and departments a week or two ago had reported there was some delay in getting their allocation of doses. With more than 70 regional health districts and full or part-time local health departments, have all of them been allocated vaccine doses at this point?
No, not all of them have asked for vaccine doses. So, depending on the town you're in or the region of the state, it's going to be a different configuration of hospitals, local health departments, pharmacies, federally qualified health centers, and other providers who are going to be providing coverage. And our team at DPH is working with all of those constituencies to make sure we've got good coverage around the state. But depending on what part of the state you're in, it may not be your local health department. It may be different providers. So we're working with all the providers who've enrolled, but not all of the local public health departments have.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, we've heard from some teachers who've had their vaccination appointments canceled. Can you talk a little bit about what is happening with cancellations, if how many might be happening? I know it's not on the scale of what you're talking about in New York, but what is happening here?
I'll start with this, Sue, and then Josh can help me out. First of all, teachers were not supposed to be on the 1A list or eligible at this point. We gave some broad discretion, so a few of the schools, some of the teachers did get vaccinated. Josh, can you talk about anything that's been canceled, or if you've been vaccinated, you're going to get your second vaccine, aren't you?
That's correct. So a couple of items that have come up recently on this topic for teachers or anyone who has accidentally gotten their first vaccine out of order, we are asking those people to go ahead and get the second dose on schedule. We want people to complete the course if they've started it. And as you said, Governor, there were a handful of districts that accidentally uploaded their entire roster of school employees as opposed to just the school nurses, which is what the instructions were. Department of Public Health did request and put out guidance last weekend that any appointments that were scheduled after today, so after this Thursday today, should be canceled, but we've allowed any appointments that were booked up until today to go forward, just to not create excess disruption in the scheduling process and make sure that we're making most efficient use of the doses we have. So, obviously the communication can always be better amongst everybody, but we think that issue is cleared up. We don't think there was a very widespread set of issues, and overall the providers are doing a fantastic job.
And just to be clear, right now, really nobody besides people in the first phase or anyone 75 and older should be signing up for a vaccine right now, right?
That's correct.
Has there been an issue too with people kind of hedging their bets and making appointments on different platforms? Because I've actually heard from a couple people who've done that. Like they're keeping a couple appointments just in case one falls through. Yes,
I've heard of some cases of that. So that's understood. The only thing we would request is that if you do have multiple appointments booked and you get or you improve your appointment slot, please remember to go back and cancel the other one, just to help ensure that that spot can get refilled with someone else and we don't end up with no-shows at clinics.
And regarding the congregate settings, I apologize for not remembering this, but are college dorms part of that group when we get to that point?
Not at this stage, no.
Okay. And just one other quick question. I wondered if the state has any kind of a ballpark figure in terms of how much has been spent on security, given the unrest in Washington.
Yeah, General Yvonne or Paul, do you have an idea on that? Well, I seem to have lost him if we're still here, but go ahead.
Sorry about that. Sue, can you just repeat the question again?
I wondered if you had some sort of a ballpark figure in terms of how much has been spent on ramped up security, and also including the cost of sending the National Guard to Washington, but also have them here.
Yeah. It's too early to tell at this time, but we'll have a better sense of that over the coming weeks, especially as the overall security is completely ramped down.
Okay, thanks a lot.
The Day of New London. The Waterbury Republican American.
Thank you. Sorry, a little technical difficulty there. Governor, the Labor Committee is raising a bill that's going to involve providing COVID-19 relief to workers. And one of the provisions the chairs indicated today will be the creation of a rebuttable presumption in workers' compensation regarding, basically designating COVID-19 as a work-related illness. You issued an executive order in July that provided for such coverage or authorized that presumption for claims filed, I believe, from March 10th to May 20th. What are your thoughts on making that a permanent part of the workers' compensation system?
I got to take a look at that, Paul, but my sense is if it's as open-ended as you described it, companies would be a little wary about opening up.
But you were willing to do that for a 3-month period?
I was during the height of the pandemic, back in the spring, when employees were going to work at some risk. During that limited period of time, if they filed a claim, I said, yes, for that group of people, there ought to be a presumption. But I did not want to make it an open-ended presumption forever.
Okay. And I know I asked this the other day, but we're getting calls and with from people 75 and older and their family members who are having problems with the appointment system. Is there any more thought being given to establishing some sort of centralized, complaint line, complaint center, help center?
Well, there's certainly a help center. We've given the number before. It's also 211. I don't have it here. I think there's actually been probably tens of thousands of calls to that help center for the people that don't feel comfortable doing over the internet. And as you know, many health providers are reaching out to the seniors as well. So reaching out and letting them know that they're eligible to get vaccinated.
Yeah, and I just add to remind folks, the number the governor is referring to is 877-918-2224, access line for people who are not comfortable, 75-year-olds and up who are not comfortable booking online. And we are, to be clear, Paul, we are aware of some of the feedback on the VAM system that was provided by the CDC, and we're in discussions with them about, features that could be improved there. And we're always looking at other options about how we can make access even easier for people. So this is an area that we're focused on.
Okay, and Governor, and maybe Paul can chime in here too, concerning your executive orders, it would seem to me that you know, it was kind of inevitable that they would be extended. I mean, I haven't really heard legislators say that they want to legislate mask wearing, for example. I mean, it would seem while this pandemic is still on us that there would be a need for, I guess, nimble and expeditious actions. And also, it's still not clear to what extent the legislature wants to legislate management of the state response to this pandemic or the future public health crises.
Yeah, I think that's right, Paul. I mean, I can tell you that when we said February 9th, that was some months ago. We did that with the legislative leadership or the key committee as well. You know, we hope, let's say January, things are really under control, much lower. We may not need that executive power, but as you know, we're 5-6% still, which is a relatively high rate. A lot of our schools in and out. So I think we are going to ask, and I think the legislative leadership would like to give us a little more time. Paul, you're going to add something?
No, I was just going to say, Governor, it sounded like Paul was answering his own question. But overall, like I said, we're going to have conversations with the legislative leaders as early as next week about the overall requests from the administration.
Well, I guess we're all trying to figure out just how this power sharing arrangement is going to be working, because we've certainly heard complaints about the legislature not being involved in unilateral executive action. I'm just wondering, when you get into these discussions, at you know, what level of legislative involvement do you think is practical?
Well, here's the great part, Paul. The legislature's in session. They have unilateral action where they can basically say that the governor's executive orders that he's put forth in their mind is not valid, as the governor said earlier, or that they're not in agreement with. So I think different than what we've been dealing with before, with the legislature in session, the two chambers can come in and take some actions as it deals with whether or not they're in disagreement with the governor's executive orders. With that said, Paul, we have been completely collaborative with our executive orders. If you notice, you haven't seen a press release announcing an executive order in quite a while, because we make sure that any executive order has broad agreement and broad understanding and fits within the policy overall goals of the emergency declaration that we're under and public health emergency that we're under. So as we've always said, we feel very confident about how we've utilized this authority in a very diligent manner. And we always want to make sure that anything we put forward is put forward and can be not only defensible, not only legally, but everyone has a full understanding of the why. And that's more important. The most important part is public health and safety during a public health emergency.
Well, you guys have gone through the alphabet about 3 or 4 times. It's January 21st. February 9th is coming up. I haven't seen any move by the legislature to either codify or prohibit any kind of order. I mean, is it even possible from the executive branch's point of view for the legislative branch to review all those orders and decide which ones they want to keep and which ones they don't before February 9th?
They've been in session, Paul. So if they would like to, they can. But as I've said before, we work very collaboratively with the legislative leaders during this process, and we'll continue to do so. And we look forward to having an official meeting with them next week to discuss it.
Okay, I know there's other people waiting to ask questions. Thank you very much.
The Connecticut Mirror.
Hi, Governor. One issue we've heard about that's come up is folks who are calling into the state's vaccine call center line that want to schedule appointments. Those appointments are being scheduled through the East Hartford drive-through site, just that location. Obviously, for someone that lives a great distance from East Hartford, that can be problematic. Can you address that?
Hey, Josh, you have any intel on that from Jenna?
Yeah, absolutely. So it's a great question, Jenna. And we have been working with providers across the state to add, what we call inventory, right? Appointment slots to the group that's answering the calls on that call center line, so that they can start booking people into other parts of the state as well. So that's happening as we speak, and there will be many more options for people who call into that line, in addition to additional options that folks have to book directly with different providers and healthcare systems around the state as well.
Okay. And can you see how many appointments you booked through the call line versus how many have come in through VAMS?
As of yesterday, there was over 2,400 appointments booked on the call line. I don't have the update from today. Assume it's well north of that already, but we can get you updated numbers on both of those.
And lastly, the VAMS system appears to only have forms for people in English. I understand that's not a state system, but could you talk about what, if anything, Connecticut is doing to help ensure access for non-English speakers?
Yes, it is a known shortcoming of that system, and it was one of the main reasons we prioritized getting that call center set up. As you know, through 2-in-1 team, they have multilingual support and can support other needs for access, as well as through the other providers, hospital systems, and so forth. So it's one of the many things we have on the list that we'd like to see that system improved. Just back to your prior point too, Jenna, those two channels, VAMS and the call center, they handle a portion of the volume, but just for point of reference, yesterday alone, we did about 18,000 vaccinations across the state in one day. So, the volume has really ramped up. This week will be a high watermark because we've gotten this extra 50,000 doses. But the amount of access across the state at a wide variety of different providers is really pretty extensive at this point.
CT News Junkie.
Thanks, Max. Hi, everybody. I hear you guys saying a lot. We need more vaccines. We can handle more vaccines. Obviously, there's competition for vaccines. What are you hoping for? Are you hoping that maybe the federal government diverts doses from states that aren't doing as good a job maybe as implementing this and gives it to states like Connecticut that are?
That'd be nice, Hugh, but I don't think so. I think this is so much better than the way they did the PPE some months ago. I like the idea of the bulk purchasing. I think they ought to be better at giving us intel in terms of how much we can expect when. I don't want to see 50 states all in brutal competition with each other. I think that's not the way to go.
Okay. One other thing, the House Republican leader sent out a press release today sort of questioning where we were at finding another permanent public health commissioner. Obviously, Dr. Gifford has a lot on her plate these days, but it's a fair question. Where are we at as far as finding a permanent replacement?
Right now, we have an extraordinary acting commissioner of public health who has very strong deputies, both at DSS and DPH. That said, we're going to continue to look to find the absolute right person for that job.
Are there any candidates yet?
We actually put the search on hold several months ago. Commissioner Gifford, as the governor said, has been doing such a phenomenal job. And in particular, the team of deputies at DSS has really allowed her to focus extensively on the public health crisis. And no one was excited about bringing in a brand new public health commissioner in the middle of a pandemic. And because Commissioner Gifford has been just absolutely phenomenal and working absolutely around the clock 7 days a week, like so many other of our teammates here, we've got a great team on the field. We're really happy with the leadership we have, and we want to stick with it until we get through the pandemic.
Okay, thanks, everybody.
Thanks, Hugh.
The Hartford Current.
Hey everybody, this is Emily Brindley from The Current. First question for you. I was wondering, so looking at the nursing home numbers recently in the past few weeks, it looks like the case rate and death rate have been going down. Is that mostly attributable to the vaccinations in those places, or is there another factor at play here too?
We looked at the data on this last week, and I think maybe we're starting to see a little bit of a benefit from the vaccinations starting to creep in, but the reality is when you do the math from when that first set of doses was administered in those first nursing homes starting around December 21st, you go 10 to 14 days after that when you start to get some protection from the vaccine. then potentially being tested, let's say the week after that, then those test results starting to show up in the data. The time lag is considerable. So I think most of the benefit we've started to see there is a result of the hard work of the teams, the rigorous testing, the infection control efforts that the teams are making across the state, the great support from DPH, the great support from General Yvonne, who maybe it's a good opportunity for him to jump in here too and talk a little bit about a lot of the work the Guard has done helping to support our response, supporting our nursing homes and our long-term care facilities. They've been an integral part of helping to drive those numbers down. General Yvonne?
Yeah, thanks, Jeff. It's a great question. And one of the things we wanted to highlight today, as you know, from the last week, 2 weeks leading into the inauguration, that we've been pretty busy, both at the state capitol and our nation's capital. But one of the things that we wanted to highlight today was that, the governor's direction, we're going to add another 200 service members, 200 Connecticut Guardsmen to help with the vaccination effort. So either administrative or logistical support that will help establish some of these mass vaccination clinics. So in addition to all the hard work that the team has done, we're really honored and blessed to have some great nutmeggers, Connecticut citizens who raised their right hand, who volunteered, and who are doing great work, yeoman's work, day in and day out, to combat the pandemic and everything you saw with the ramp up security-wise to the inauguration as well.
And then I also wanted to talk about those out-of-order vaccinations that we've heard quite a bit about over the past week or so. It looks like it includes, obviously, school staff that has been discussed. There were also some number of residents between the ages of 65 and 74 who were able to sign up through VAMS as well. So I was wondering, does the state have a sense of the scale of people who were mistakenly vaccinated before they're actually eligible? Like, how many people are we talking about here?
We don't have an exact number, Emily, but we think the number is very small in the grand scheme of things. We checked with a couple of the major providers. They did a quick scan on the reservation book of business, and over 95% was 75 and above. And that would include still some phase 1A people trickling in as well. So it's going to be a very small percentage, very small number of people.
Would you be able to give me a ballpark figure or a range maybe?
Yeah, like I said, I think it's less than 5%, probably a very small number.
Less than 5% of this week's vaccination, so of 50,000?
That would be yeah, I don't even want to give you that number, Emily, because I know that would be a high watermark, and the real number is likely much smaller.
Okay, all right. And then the one last question I had for you, I believe it was on Tuesday. All the days are running together at this point. But I think it was on Tuesday when the governor laid out some timelines for when the rest of the phase 1B groups would be vaccinated. And then you guys talked a bit about how the congregate settings will be vaccinated on a parallel timeline, but there weren't any estimated dates associated with that. I was wondering why there weren't any estimated dates given for those in congregate settings. I understand there's a shortage of vaccines, but there were estimated dates given for every other group in phase 1B. So why not congregate settings?
Yeah, as the governor said, the congregate settings are going to run in parallel for the entire phase 1B over the next 2.5 months or so. And we'll get started on that in the next several days. But those facilities take longer to get organized. They're more logistically complex. We need mobile teams. And that's why they're running in parallel, because it's going to take a while to work our way through all of them. But we'll get started with those in probably within the next week.
Does that include prisons as well? Vaccinations will start there in the next week?
We haven't set a specific date there yet, but we are looking at options to start vaccinating, particularly the elderly offenders in those facilities sooner rather than later, kind of in line with their general population timeline. We've come up with some. Commissioner Kuros is coming up with some creative ways to be able to do that in an efficient manner. So that'll start in the coming weeks as well.
All right, thank you, everybody.
Hearst, Connecticut Media.
Hey, Governor. I know it was said earlier that we are getting 50,000 doses this week. Is that looking to be recurring? Have you heard anything from the Biden administration that would suggest that we might get another 50,000 additional doses down the road?
Peter, sadly, no. I think it was quote, one-shot deal to thank Connecticut, reward Connecticut for having done a pretty good job of getting people vaccinated. I've heard from some other governors on the subject. My sense is we're going to go back to a normal course of business now.
Thanks. And then circling back on that, Rhode Island and Massachusetts getting rid of their curfews. Is there a tipping point for you where you would think to do that? I know you said schools are coming back, so that was your hesitancy.
Yeah, I didn't know about Rhode Island changing, but what we tried to do is be relatively consistent. I mean, Rhode Island, Massachusetts, New York, they've had on, they've had off, they've had pauses. What I'd like to try and do is do everything we can on a steady basis. And when I do make a change that I feel pretty confident can be permanent. Have we always gotten that right? No, but we've been pretty darn consistent. So that's why I said, Peter, give us a little more time. There's a lot happening in and around the market over the next couple of weeks. And then I'd feel a lot more confident, and we'd have more vaccines, probably more clarity about how fast people can get vaccinated. And that might give us an opportunity to open up a little bit more.
Thanks. And then have you thought to, I don't know, maybe this is a question for General Yvonne, has there been any thought to adding more overflow capacity for hospitals? We've spoken to some ER doctors who said they've been slammed with patients recently.
So that'd probably be most likely be a decision for public health, but I can tell you we do have the overflow set up currently at the convention center. It's ready to go. And that was set up right before the new year.
Hey, thank you, everybody. We've got our next Biden briefing coming up. I appreciate in their busy schedule, they gave us enough time so we could give our COVID update. And General Yvonne, thank you for joining us. And just remember, to each and every one of the Guard who are out there, we're remembering them every day, and that's why we're talking about you today. Thanks, everybody.